Hello everyone, welcome to my channel. Today's video is about vomiting related to medical surgical nursing. It is about vomiting. Let's get started. Introducing vomiting. Vomiting is a partially voluntary act of forcefully expelling gastric or intestinal products through the mouth. It is a partially voluntary, means we do it partially by our will, and there is a forceful expelling of gastric or intestinal products through the mouth. A similar symptom related to vomiting is nausea. Nausea is an unpleasant subjective sensation. It can be different from one person to another, so subjective, unpleasant subjective sensation that most people experience as a feeling of impending vomiting in the epigastrium or throat. So, people suffering from nausea can face vomiting after that episode. Etiology for vomiting can be, first of all, mechanical obstruction in GI tract, as vomiting is the outlet of GI tract contents. So, this mechanical obstruction is related to foreign body and intestine. Next is gastric outlet obstruction, disease in which gastric outlet obstruction occurs is tumor. Small bowel obstruction, that is scar tissue or hernia. Motility disorders, movement disorder. There is a involuntary movement inside GI tract called as peristalsis. In this motility disorders, peristalsis is disturbed. That is achalasia, fecal incontinence, and other disease condition in which vomiting occurs are appendicitis, cholecystitis, hepatitis, gastric and duodenal ulcer disease. Moving ahead, medications that can cause nausea and vomiting are chemotherapy drugs like cisplatin, analgesics like NSAIDs, antiarrhythmics like digoxin, oral contraceptives, that is COC, combined oral contraceptives, anti-Parkinson's drug like bromocriptine, anticonvulsants like phenytoin. These drugs can cause nausea and vomiting. Nausea and vomiting are the side effects of these drugs. Pathophysiology of vomiting. First of all, vomiting always starts from nausea, starts from a subjective feeling. So first nausea develops as a result of activation of cerebral cortex. The stomach relaxes and intestinal peristalsis are inhibited. So first of all nausea develops and the message reaches towards brain. Stomach relaxes, that means smooth muscle inside the stomach relaxes, and involuntary intestinal movement, that is intestinal peristalsis, are stopped, inhibited. After that, retching occurs. Retching is a movement, abnormal movement, in which spasmodic contraction of diaphragm or intercostal muscles combined with the closure of glottis. Glottis is the anatomical structure located nearby the esophagus. So because of retching, there is a activation of spasmodic contraction, painful contraction of the diaphragm. And because of that contraction, there is a closure of glottis and GI tract product, upper GI tract product forcefully comes out through mouth because of that contraction. The forceful contraction is known as forceful retrograde peristaltic contraction. Forceful because forcefully the contents come out. Retrograde is it follows against the gravity. It comes against the gravity. The product comes against the gravity. Peristalsis movement, and contraction because it is related to contraction of smooth muscles. So forceful retrograde peristaltic contraction. And along with that, there is contraction of diaphragm, abdominal muscle, and relaxation of lower esophageal sphincter. After that, products of GI tract releases out. Upper layer of GI tract, that is epigastrium, upper part of the abdomen, contains acid. So, vomit contains GI tract product along with acid. Contents of vomit are, first of all, bile, bilious. If there is gastric outlet obstruction, then content is bilious. If there is achalasia or stricture, then content is undigested food. If it is due to anaphylaxis, then allergy, anaphylaxis, then it is if then digested food can be found as a content of vomit. If there is suspected upper GI tract bleeding, then hematomesis. Hemato is blood, emesis is vomiting. So blood in the vomit can be noticed. And if there is distal bowel obstruction, distal is opposite to proximal. Proximal means near to the center, distal means away from the center. So if there is distal inside bowel obstruction or fistula, then fecal matter also can be seen in the contents of vomit. Clinical features of vomiting are poor skin turgor, dehydration, fever, abdomen distension, mild headache, and dry mucous membrane. Because of dehydration, there is dry mucous membrane. Mild headache can be CNS symptoms, and abdomen distension occurs because of the imbalance of the GI tract products. To diagnose vomiting, we can diagnose the electrolyte level of the body, blood glucose level, calcium level of the body, because all these can be lost through vomiting. After that, there can be a complete blood count, CBC, and a renal function test, because urine output is also reduced if there is severe vomiting. Next is pregnancy test should be done for diagnosis to confirm that is the woman pregnant or not, because vomiting is the symptoms of first trimester of pregnancy. Next is serum lipase and amylase test. These enzyme tests should be done in order to find the disbalance in GI tract function. After that, general management. General management of vomiting can be, first of all, finding out the etiology and managing the etiology. After that, symptomatic relief. All the symptoms that the patients are facing, they can be managed temporarily. Next is where there is any drug administration which is causing the vomiting. Preventive measures should be used before administering that drug. Patient should be allowed to sit comfortably so that the patient can maintain a comfortable position. Any distraction like foul smell, noise in the surroundings should be removed. Patient should not be offered any solid food just after the vomiting episode, because there is disturbance in peristalsis, movement of GI tract. So patient should not be offered any solid food, as that solid food also might come back through another episode of vomiting very soon. Medical management of vomiting can be, first of all, antihistamine for vestibular disorders. Meclizine can be given. Next is anticholinergic for any kind of GI tract disorders. Scopolamine can be given. Next is dopamine antagonist. That is metoclopramide can be given as a medical management. But these medicine are given only after the diagnosis of disease condition, not just for vomiting. Complications of vomiting can be, in children, vomiting causes weight loss as body fluid releases out through vomiting. So there can be weight loss if there is continuous vomiting in children. Next is cutaneous, that is related to skin. There might be petechia or purpura in the skin. Next is sore throat, and then esophagitis, inflammation of esophagus, electrolyte imbalance. If there is a distal GI tract problem, then electrolytes are also lost through vomiting. Next is metabolic alkalosis, very important. I have already explained that vomiting contents are especially normally from the upper GI tract. Upper GI tract contains acid. So through vomiting, acid is lost from the body. When there is acid loss from the body, alkali becomes higher than normal level. So body faces metabolic alkalosis. Opposite in diarrhea. In diarrhea, body loses electrolytes from the intestine. So when electrolytes that are alkali are lost from the body, there is only acid remaining more than normal. So when there is diarrhea for a long time, patient can face metabolic acidosis, and when there is vomiting, patient can face metabolic alkalosis. Similarly, hypokalemia and hyponatremia can also occur as a complication of vomiting. Thank you so much. Next note will be provided through next video.